Is it recording?
Yes.
Okay, right. Okay. So,
I said 3, 2, 1 in there.
I don't understand. Right. So first of all, I'm going to start on just some fascial work to warm up the fascia over the masseter temporalis. So I'm just going to do one side to turn over just slightly, and I just curl my fingers underneath the mandible and I let them sink in. And then once they've sunk in, I can then just draw my hand up towards me, and I will just go slowly over the masseter, up the face, up the temporalis, and then finish off here. And then I can do that again, and when I do it the next time, I'm going to ask my client to just slowly open and close the mouth just a little bit. Okay, so you would wait until I sink in, and then when I've sunk in, I say, right, you can start open, close your mouth as I move the hand up, and then as your mouth is closing and opening, it controls the movement, well, the pace of my hand as I'm moving up. Okay, so I finish up there, and then you can just close your mouth. Now, I'm going to do the cross fibre up the masseter and the temporalis again. So you're just going to open your mouth just very slightly, just in a relaxed state. Okay, just make sure it's just relaxed. You're not forcing it open or anything. Is that okay? Okay, don't smile. Just do natural. Okay, so I just let my fingers. So I'm going to start here. Okay, you can close it a little bit. All right, I'm going to start here, and my fingers will just sink into the tissues. Is it still recording? It's gone dim.
No, it's recording. It should be recording.
Okay, right, so my fingers are going to sink in, and then as they sink in, I'm going to just move them down towards the couch slowly. And then I'll do the same up, so I move up a little bit. Again, let my fingers sink in. And then once they have, I can then just direct them down to the couch, and I move up and I just do the same thing again, up that way. Right, now I'm going to be working the digastric, just under the mandible. So if I want to release a jaw that is held back, held retracted, then I'd start here, and I will let my fingers sink in. And what you're going to do is, when I'm ready and I let my fingers sink in, is you're going to sort of push your jaw forward. It's like you're going to push your chin up to the ceiling. Okay, so let's say that my fingers are sinking in, and then if you're just going to push your jaw up to the ceiling, and then I can move my fingers back towards the back of the digastric, and then you just bring your chin back to normal, to neutral. Right, if I go the other way, I'm going to release a jaw that's held protracted, so stuck forward. So I do the other way, so I find the posterior end of digastric, and as I sink in, what you're going to do is you're going to move your jaw back into you, so it's like a really minuscule movement. So if I sink in and then I start to move forward, and you just move your jaw back a little bit, just into you. Are you doing that? Okay, right. Okay, so then I will just move forward while she's doing that. Another way of doing it is this posterior digastric. If I find the mastoid process, and just in front of the mastoid process, I find the attachment to the posterior digastric, and then I have to let my fingers sink in, and then if you can just slide your jaw forward. Are you sliding your jaw forward? Oh, okay, right, it's a really tiny movement. And then if I would feel anything, or you would feel anything like any clicking to one side, that means it's deviated. And I would then try to just palpate at that point while you swing your jaw to one side to release, or to the other side. Well, whichever one it's swinging towards. You're actually okay, because I can't feel anything. Right. The next thing is the SCM. So if I put my fingers, I don't know if you can see, if I put my fingers just under the upper trapezius and my thumb is going to go flat just here at the SCM, and I would sink in, and then once I've sunk in I would just bring my thumb up towards me. Okay, and I would do that again on the other side. And then for fascia release of the SCM, again I start in the same position, but I'm going to start here at the top. So what you're going to do is you're actually, when I'm ready, you're going to move your head to one side just slowly and then back, okay? So if I sink in, and then you can just move your head to one side, and as she does that, I'm just going to keep my thumb there so she's in control of this movement. And then you'd move it back, and I would then go down, again sink in, and then you do the same thing again. Okay, and then of course we do it on the other side. Is it still recording? It seems to go dim every time. Okay, right.
It's still recording.
Okay, because I can't see anything. Alright, so, so I'm going to now do some inner mouth work. So I need to so if I just come this side, I get ready to do my work here. So, oops. So first of all, I'm going to do a floor of mouth work for digastric. So I'll be sitting on one side, slightly here. Right, so if there's any discomfort, you're going to, well, be careful. You're going to just raise a limb. Well, probably your arm, actually. Be careful you don't knock this over, okay? So you're going to raise an arm or a hand if you're uncomfortable, you want me to pull out. So you're just going to open your mouth, and I'm just going to go behind the lower teeth, and you're just going to close as best as you can, and I'll wait until I can just feel into the soft tissue. I'm very relaxed, and then my fingers are going to come under the chin to meet them, and so I'm just sinking into the soft tissue very lightly, and I'll wait here if there's any release. Okay, so let's just come out. Right, and I'm just going to come to this side. Alright, so we're going to do inner mouth work for tending of temporalis. So this time you're going to just open your mouth a little bit. Alright, and then close it. And so my little finger with my nail is going right, touching her lower teeth, and I'm going towards the back. And I'm just feeling very gently for the gap between her lower furthest back teeth and the bone, and I just go as far as I can. I'm just going to stay there, and as I stay there I will feel for any releases, and if there's any releases going on then I can move a bit further back. Okay, and the next one, so I'm just going to pull out here, it's okay. Next one I'm going to do is intraoral work for the medial pterygoids. So I may not be able to stay very long on this one because she's a little bit sensitive. So what we're going to do is we're just going to open. So I've got my finger on the bite of her back teeth, and I'm just going to slide down and to an angle until I can get into the soft tissue. Okay. And then when I'm there, I can bring my thumb onto the other side just to rest it. And just very gently, I just wait for any releases. So I'm going right down the back, underneath her tongue, into the soft tissue area. Right, so I'm going to come out there because I know this isn't your favourite bit. Okay, let me just take this off. And if, say, it's like my client, somebody's not comfortable with the intraoral work for the pterygoids, medial pterygoids, then I can do this extraorally, in which case what I do is I'm just going to come around here. So I find the angle of her mandible, and for me I'm going to go like this because it's more comfortable. So I found the angle of the mandible, and I just wait, I sink in, and I just wait, and I intend my movements upwards so that I'll be reaching them there, and then again I can wait for release as I sink in. Okay, so that's the extraoral for the medial pterygoids. Now the next bit would be transverse fascial plane. So we assume that I've done the vertebral artery test just to see if she's got involuntary movement of the eyes, and then because you don't want to see it, we'll assume that I've done the fascial sandwich on the pelvic and fascial sandwich on the respiratory diaphragm. So I'm going to just demonstrate the fascial sandwich for the thoracic diaphragm. So what you're going to do is just going to let me come underneath, just lift up a little bit without upsetting this thing. Okay, actually don't lift because you might upset it. I'm going to come with my hand just in between her scapula. Okay, so I'm in between her scapula, and the other hand is just going to come up over the top so that my fingers are resting about where her clavicle is. And I'm just going to lift a little bit so there's absolutely no pressure on there. And that's my sandwich. So I will wait, see if there's any releases. I relax both my hands, very light. And then once I've finished, and there's no movement, I just withdraw my intention and withdraw my hands. I'm just going to withdraw this one, don't move. Okay, and then I'll do the same fascial sandwich for the hyoid. So be careful if it's any discomfort, you have to, actually don't move your hands just in case you knock this over, just shout or something, okay, if you don't like it. So I'm just going to go with my hand, just raise a little bit your head, just raise your head a little bit, okay, I'll go under. So I'm just under her upper cervical vertebrae. I'm going to find her hyoid, so I use these because it's easier for me. And you can swallow. Okay, you can just swallow. Okay, so just to make sure I got the right point. And I'm just going to rest and lighten my pressure, and then wait for any releases, and maybe intend for the hyoid just to move slightly downwards as well. So when I've finished with releases, I will just again withdraw my intention, and then my top hand and my bottom hand, and then I'm going to do the just release at the occiput. So my fingers are going to go just beyond the occipital ridge, and what I'm going to do is I'm waiting just for her head on its own to just drop, and you're just going to just let it go. You're not forcing it down, just letting it go until it drops onto the couch. And then when it does that, it's not quite there, but anyway, when it does that, then I can just bring my other fingers to join just at the occipital ridge, and then just release, let go, and wait for any movement or releases there. Right, so that's some of the fascial work sandwiches and the fascial planes. And the next one is for decompressing the temporal bone. I'm just going to do the ear pulls. So I'm not actually going to pull, but just getting my thumb, my fingers ready, my fingers underneath, and I just rest, and I intend for the ears just to come outwards slightly outwards, slightly up. And then I would just hold there for a while just to wait to see if there's any release, any movement, and go with it. And then when that's done, again, I just withdraw and I can let go. The other thing is sphenoid, the sphenoid around here. I'm going to do compression of the sphenoid. So just let go. It's okay. So my fingers are just at the occiput, just underneath the occiput. And I bring my thumbs up, just behind the eyebrow, or sorry, to the side of the eyebrow, just to where the soft tissue is, the temples are. And I'm just going to rest my thumbs there until I feel there's a connection there. And then when I do, I intend for the thumbs to move up, so like up to the ceiling. And then when I've done that, I'm going to do now decompression. So I'm just going to release and then find the area again, the soft tissue where the temples are, and just connect, just rest my thumbs, just connect. And this time I'm going to just go the other way, so I'm going to intend my thumbs to just move down towards the couch. Okay, and again I would hold it there and then gently let go. Right, the next thing is I'm going to do some movements to help rebalance the cranial bones. So, oops. Right, so I'm going to find the greater wings of the sphenoid, so where the temples are. Alright, so this is going to be inside the mouth. Okay, if there's any discomfort, do let me know and I will just pull out and give you a break. Okay, so just going to open the mouth. Okay, can you open the mouth? Okay, can you open, are you asleep? Can you open the mouth, please? Okay, that's good, right. I'm just going to go with my fingers on the biting surface, and I got absolutely no pressure on my on the sphenoid. I'm just resting my thumb and finger there, and I'm going to see if I can just feel the rocking movement of the sphenoid, and the maxilla will be if I can feel the widening and narrowing of the sphenoid. And if I feel that it's stuck in one direction or it's not releasing, then I would just stabilize the sphenoid, so put the tiniest bit of pressure on the greater wings of the sphenoid, and I'm just going to see, oops, okay, right, let's just relax that. I'm going to see if I can test for torsion, which is the rotation of the maxilla. So just rest my thumb and my finger there. Okay, open up. And this hand, I'm just resting my fingers on the biting surface of the upper teeth. And I'm just going to stabilize the sphenoid, so a little bit of pressure while I gently intend rotation of the maxilla to one way, so I'm going away from me actually. And then if I feel release, I will follow that and then let go and rest my fingers, oops, very lightly, and again just see if I can feel the motion of both of them. Right, and the next one is testing for shear, so if the maxilla is moving towards me or away from me. So again, I just rest my thumb and finger on the greater wing. If you just open up, just open up your mouth, open your mouth. Okay, so my fingers are going to go on the biting surface of the upper teeth, and I'm just going to feel if there's any movement towards me or away from me horizontally. And if I feel that I want to release in one direction or another, I just put a little bit of pressure on my thumb and my finger and the sphenoid, just a tiny bit of pressure, and I intend for the maxilla to move, in this case example, away from me. And then when it does that, I can wait for a release and follow that. And I can relax and just again test if there's a rocking movement here and if there's a horizontal movement in the maxilla. Right, the next one is testing for impaction. So again, find the greater brain and the sphenoid and just very lightly rest there. You're just going to open up again. I'm just going to go with my finger behind your, just open up, open, okay, I can close a bit. So this finger just behind the top front teeth. I'm just going to see if I can just feel any movement of the maxilla upwards. And if I feel that I want to, that it's impacted, it needs to be moved, then I would get my piece of gauze. I've actually got a piece of gauze ready. And I wrap my piece of gauze around my finger. Okay, just get my fingers ready on the sphenoid. I open up again, open up, open, okay. And then I just put my finger with the gauze. Actually, I've got too much gauze here. And then I would intend for my finger to move upwards. And then go with the release. Alright, so it's done with that. Right. The last one is the zygomatic arch, which is along here. So just going to rest my thumb and finger there, and you're going to open your mouth. So just open your mouth. Okay. I'm going to pull this out and you're going to close. Okay, you're closed. So I'm moving up as far as I can towards the zygomatic arch, and I like to put my thumb on the outside. So I just stabilise this bit by putting a little bit of pressure on my thumb and finger, and then when I'm ready, I intend for my hand to bring the zygomatic arch towards me, and then again hold, wait for release, and then I can let go. And then take off any pressure. Right.